So today we'll be discussing so many very good HRCTs of the chest. Now this is the first HRCT chest where what we need to see is the lung parenchyma. The most important thing is the lung parenchyma that we need to see. So before seeing the lung parenchyma, the central portion is of heart. This is all heart. This is all heart. The all radiolucent part, that is all lungs, which is right lung, this is left lung. So we need to see that this is right lung and this is all left lung which is there. Now whenever we are seeing the lungs, we need to see how the lungs are. So in the lungs, the most portion should be as radiolucent as this. There should not be significant white bands. There should not be any collection. Now, see, this is the vertebra. You can see very well. This is the vertebra, right? This is the vertebra. This is the spine. This is the vertebral body. So, in short, this is the vertebra, and the patient is lying down on the bed like this, where the CT scan is being done. So, this is the dependent portion. So, if you want to see effusion, if the patient has effusion, means a collection of fluid, collection of blood, or connection of liquid, that is what is an effusion is. It will be in this dependent portion, so it will appear here and the lung will be displaced up. I'll show you that as well. So you should always see whether there is an effusion here or not. So this is the reason. This is an anterior area, this is the posterior or back portion of the body, and the patient is lying down in this CT scan machine like this. So we should be able to see if there is some effusion here. The same goes for pneumothorax, but in pneumothorax, it will be outside the lung parenchyma, and it will simply displace the lung towards inside. But in pneumothorax, it will be as pneumo means air, and it will be as dark as this. This is all air. This is the attenuation of this blackness is an attenuation of air. So if it is pneumothorax, it will not appear black like this, but it will appear black like this. So the water or liquid will appear like this. The attenuation of like this whiteness will be of effusion. So the this city in this city we can see lungs, they are pretty okay. There is no any patch. The lung is pretty decent. There are no significant any fibrotic bands. If there is a consolidation, means pneumonia, there will be a white patch which may be like this or which may be like this. This will be definitely white, not red. And just to show, I'm showing this may be like this. If it is a bacterial pneumonia, the patch will be mostly always unilateral and localized to a one particular portion. And if it is a viral pneumonia like COVID-19 or H1N1, patient may have multiple small patches of pneumonia like this in both the lung fields, in both upper, middle, and lower lung fields as well. So, if you want to see effusion, see the uh, see the dependent portion. If you want to see a pneumothorax, you should be able to see this is the trachea. This is the central portion because this is left, this is right, this is the center of the body. So this is a trachea, this is a trachea, and trachea has what? Air inside the trachea. So this blackness is of air. So this is blackness of the air. What you need to see also, ki there should not be any pulling or pushing of the mediastinal structure, as this portion is of mediastinum. This is all heart portion. This is trachea, and the trachea is exactly almost in the center, slightly toward the right, which is a normal variant. So if you see, trachea is in the center, 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 center. It is divided into two main bronchi, now it is going towards both the lungs. So, and this mediastinal structure, they are almost in the center only. So they are not pulled or pushed anywhere. So there is no any pneumonia patch, there is no any effusion, there is no any pneumothorax as well, and the lung parenchyma is pretty decent. There are some fibrotic streaks, but they are okay. This patient has a very typical of COPD. This is a very typical CT scan of a COPD. Why? Because in COPD, we very commonly get a barrel-shaped chest. We must remember normal chest, the horizontal diameter is always more than the vertical diameter. But in barrel-shaped chest, as we know, it is a barrel. Barrel is almost completely circular. So in here also we can see this is completely circular. We say it is barrel-shaped when this antero-posterior diameter is as equal as this transfer diameter, which is the scenario in this HRCT. So here the anteroposterior diameter is as equal as transfer diameter. So this is a barrel shaped chest, very typical of COPD. That is the reason why we also have some small minimal fibrotic bands which are not very significant. Now, when we come to some other CT scan, now I can show here the effusion. Effusion. We can show the effusion here. So very nicely we can make out that this is the vertebral body. The patient is lying down, sleeping, and see here. Uh, if you see in here, so this is the rib. This is the rib. So this the dense white structure is rib. Here we can see the lung, but there is no effusion. But just compare this with this thing. Now this is the rib, this is the rib, this is all the lung, and this everything is effusion. This all is effusion. So we need to remember that effusion will be denser than air like this, but it will be less dense than a pneumonia and bone. So this attenuation is all of effusion. So we can see there is a significantly moderate effusion on the left side, and this is all dependent portion because this is a liquid, so it settles over the body. So on the right side there is not much of effusion, but on the left side there is significant effusion which we can very see. Just see, this is the bone, this is the rib. Just above there is a very mild effusion. This is all effusion, but on the left side there is significant effusion is there. So this is a moderate effusion. As it is only unilateral, the chances of it being infective is very high, because if it is systemic like heart failure, there will be almost similar effusion. But as the left-sided effusion is there, which is significant, and we can see there are significant fibrotic bands as well, which may suggest that there is an active infection on the left lung parenchyma. So a left active lung parenchyma infection causing left-sided effusion is very highly likely. Though here also we can very nicely make out that there are some significant fibrotic band. If you can see here, the lung parenchyma doesn't appear much good. So there are so much of small, dense, reticular fibrotic bands which are extensively present in both the lung fields, which highly suggests that it is a restrictive lung disease. In here, we can very nicely make out, just see, this is the left lung, this is the right lung, and here this right lung is completely collapsed by a dense black structure. This is all air. So if you can see here, this is all air. This is as black as this is bronchi, main bronchi. So this is all, this is air, this is the two main bronchi, this is as black as this, so this is all air. This is a pneumothorax causing complete or significant collapse of the right lung. So this is how a pneumothorax will appear. In here also we can see that this left lung shows dense white, so many lines, and there is significant, it appears to be significantly shrunken on the left lung field, which highly suggests that there is definitely significant restrictive lung disease also. If you can see, because of the pneumothorax, this mediastinum is significantly shifted on the left side. If you can see, the whole mediastinum, the whole heart is completely almost shifted to the left side. So on the right side, there is nothing almost left. See that the whole heart is shifted to the left side because of this pneumothorax. So this is a pneumothorax. Here also we can very nicely make out that there are so much of dense white linear structure which suggests that this is all fibrotic bands. These are as dense as this bone. See, this is bone, this is a vertebral body, so this is as dense, and vertebral body is made up of all calcium. So calcium, if there are so much of dense white streaks, this highly suggests that there has been multiple insult to this lung parenchyma, causing significant damage and fibrosis. And this fibrosis leads to the significant restriction or reduction in the compliance or elasticity of the lung. So whenever there is a reduction in the compliance or elasticity of the lung will not expand, lung will not inhale, lung will not exhale, and the patient will have continuous shortness of breath, breathlessness, and hypoxemia. Just see that in here, the all image, the lung area is so small. In the first image, we could see significant amount of the lung, but here, see, this is all fat. This is all fat. This is the rib, and this is the out portion of the rib. See, this is a very clear cut. This is rib. This is rib. You can see here. This is a rib. This is rib. Dense white. This is rib. So outside this rib is all fat, and lung appears so small. Just see the mediastinal portion appear much more large compared to the left lung. Actually, the lung should be at least 1.5 to 2 times more size than the mediastinum, but here the lung appears so small. Just see the portion of the lungs. Just see the portion of the lung which is so small compared to the fat, muscles, and the body. So this is significant. You can see there are so many dense white linear streaks suggestive of significant fibrosis, significant restrictive lung disease, causing loss of lung parenchyma because of the mostly infection, COPD, or whatever is the reason. So for today, we are good, and we'll again come up with some interesting CT scan. And thank you so much for watching.